I'm joined today by City Councillor Charmaine Williams, who will speak about Nurses Day, our appreciation for those frontline heroes during Nurses Week. I'm also joined by our Acting Commissioner of Legislative Services and Director of Bylaw Enforcement, Paul Morrison, and of course our Medical Officer of Health, Dr. Lawrence Lowe. I want to start off the briefing by highlighting I am continuing our advocacy in Brampton to the provincial government to have the restrictions on outdoor amenities lifted. It's important we listen to the science, the data, the medical advice. I was on a panel earlier this week with Dr. Peter Juni, the head of the Ontario Science Table, where he was passionately advocating for the lifting of outdoor restrictions. Whether it's golf or tennis or cricket, there are many outdoor sports that can be governed in a very safe fashion where there is physical distance. And we need to, it's been a tough enough year, we need to let people get to exercise. And if you look at the weather ahead, you know, to keep people cooped up when we have a beautiful weekend, a beautiful week ahead as the weather gets better every week, I really want to stress, if you listen to the medical advice, if you listen to the data and the science, fresh air is important. It's not only important for physical health, it's important for mental health. And I was pleased this week to see the Canadian Pediatric Society come out highlighting their concern for youth mental health, having children confined indoors for extended periods, and why it's important to get them outdoors and engaged in recreation. So I believe there is a growing momentum to have these outdoor amenities opened, growing momentum in the science community, in the medical community, and I can tell you from a municipal perspective, having these facilities shuttered, having our soccer fields closed and our cricket pitches closed and not being able to have our golf course open or tennis courts locked, it's creating a bleed for the city. Just for this year, we're forecasting based on the spring closures because of a lack of rentals. The city's going to lose $2.1 million on rentals from outdoor amenities. And so there's a financial cost on top of the physical health cost and the mental health. And so I will continue my advocacy that I believe outdoor amenities should be open even during the lockdown because they're safe and recommended by the Ontario Science Table. The next thing I wanted to mention is one activity we are allowed to do during this stay-at-home order is bicycling. That's one of the few physical activities that's permitted, and we've really expanded our active transportation map. If you're interested, you can go to brampton.ca, but we're building cycling paths around the city. We're building our first ever active transportation master plan, and so you'll notice these new signs across the city of Brampton, cycling signs guiding residents on our new cycling paths. The next thing I want to mention, some good news. We've got more pop-ups coming and vaccine availability. Right now, we just opened a new clinic at Century Gardens. I was there to do a tour yesterday. It is a city facility that we've opened up in partnership with Osler Health, and they have appointments available today. And I've just been told that by the hospital. There are appointments available today. So if you haven't got your vaccine shot, please go in to Century Gardens. We're also going to be having doses after dark, and I want to applaud Dr. Lowe and his team. I love this campaign, Doses After Dark, a 32-hour marathon clinic at the International Center. So if you work shift work and you can't get to your vaccine shot during the day, literally it's going to be 32 hours straight. So you can get your shot at any hour. So come and check out Doses After Dark. It starts on Saturday, May 15th and runs until May 16th. And we're excited to see the uptake on that, trying to make sure that we create as many opportunities to get the vaccine from those who are essential workers, working shift work, where it may be more challenging to find time in their day to get a vaccine. We're also having a pop-up clinic on May 15th with the Roots Community Services. Now, the Roots Community Services, really a respected organization in Peel Region that does work with the Black, African, and Caribbean community. And so this is going to be focused on making sure members of the Black, African, and Caribbean community get their vaccine shots. And so details are on the Roots Community Services website, the Peel Public Health website, and it's taking place at the Bramalea Civic Center. So that's another opportunity to get vaccines. I have to say, I love being able to report all these new opportunities to get vaccines. And this is what's happening. When supply is given to Peel Region, we find creative ways to make sure we can get vaccines and arms. And we're getting huge numbers done each day. And there's going to be more centers opened up, more opportunities opened up to get vaccines, specifically targeting segments of the community that where there may be a little bit of vaccine hesitancy. I also want to share a William Osler update today. There are currently 36 COVID-19 patients at Brampton Civic Hospital, including 9 in ICU. There's 21 COVID suspect patients who are awaiting test results. And Brampton continues to face capacity issues in our hospitals. Last week we saw, and this is the real numbers. When we talk about the numbers in Brampton Civic, it's one thing, but when you look at the transfer numbers, that really tells you the ongoing challenges we have. And last week, we transferred 132 patients to other Ontario hospitals, 132. I want to thank our hospital partners. They continue to do incredible work here in Peel Region. We're very fortunate to have an incredible team at Osler and at Trillium, and I really believe they supplement in a meaningful way the work of public health. On a bylaw update, we're seeing a high level of compliance. We didn't have any issues in the last weekend like we did the week before. There was only 13 charges under the Reopening Act, 1 charge under the Emergency Management and Civil Protection Act, and 1 charge under the mandatory face covering bylaws. So thank you to the public that abided by the public health regulations. And on that note, I'm going to welcome up Councillor Charmaine Williams, who's going to share some comments on behalf of the City of Brampton in regards to Nurses Week. And I just want to say on behalf of my family that we adore our nurses in Brampton on the front lines. I continue to be inspired by their sacrifice and dedication, and during Nurses Week we applaud these frontline heroes.
Thank you, Mayor Brown, and good morning, everyone. Brampton, our city, has been hit the hardest by this pandemic, but it is so important to take a moment to show gratitude to our healthcare heroes who continue to courageously step up for us. The city's response to COVID-19 has been a result of the preparation of our staff, together with our partners and largely guided by our dedicated Brampton Emergency Management team. Today we recognize international nurses as a part of National Nurses Week. Nurses have been our brave frontline heroes, making personal sacrifices every day for the benefit of those who need care, comfort, and medical attention throughout this pandemic. This year's theme is, We Answer the Call. They have certainly proven that to be true as they care for their patients, work outside of their scopes of practice, and are redeployed to other areas to effectively respond to this pandemic. They have shown themselves to be resilient in this ever-changing healthcare environment and compassionate to those who are suffering during the pandemic. Now this week we show appreciation for the essential role nurses play in all settings, including our hospitals, primary care, community settings, retirement and long-term care homes, and so much more. I would like to say thank you to Hardeep at Chinguzi Wellness Center for giving me my first shot, and the many other nurses who are vaccinating the steady flow of people getting theirs. I encourage you to reach out to a nurse and thank them personally for their dedication, because many of them are extremely tired after a long pandemic, and they need to know that you care for them very much and very much appreciate them for rising to the challenge and always answering the call. So again, despite the challenges our city has faced, it is our first responders, nurses, doctors, and local heroes who have helped us face these challenges and continue to give us hope. Thank you, and back to you, Mayor Brown.
Thank you, Councillor Williams, and now we'll hear from Dr. Lawrence Lowe, our Medical Officer of Health.
Thank you, Mayor Brown. Councillor Williams, good morning. I'd also like to extend my wishes to all of our nurses on the occasion of Nursing Week. Thank you for your work and your sacrifices through the past year. This week, Brampton's test positivity is at 16.3%, with a weekly incidence rate at 387 cases per 100,000. These numbers are both down from last week. At the same time, as of yesterday, we have reached 50% first dose coverage of Peel's adult population. These trends all give me a cautious optimism, even if we do need to stay the course for a little while yet. Certainly our transmission rates appear to be declining. However, our hospitals are continuing to transfer patients and face capacity challenges. We know that we must firmly come down the other side of this curve and continue to save lives and protect our healthcare workers and our most vulnerable in the current moment. We cannot let up yet with our hospitals still overflowing. We need to ensure that those numbers also start to come down. On the other hand, our vaccination program is also hitting its stride thanks to the provincial government's prioritization of Peel as a hotspot for additional doses. We are on pace this week to have our biggest vaccine week yet, getting over 20,000 doses in arms every day and striving to get to 150,000 doses delivered this week. 150,000 doses will add 14% coverage to first dose coverage to the community, which at 50% yesterday brings us even closer to our first goal of getting to 75% first dose coverage in Peel. Limiting our contact and interactions also remains critical to ensuring that we seal the deal and bring this third wave under control. Once the third wave is tamed, the increasing first and second dose coverage in our community will hopefully allow us to reopen gradually and with confidence. So I encourage all our residents, as I said, to stay the course. Limit your in-person interactions outside your house to only the most essential purposes, and when you do meet someone who you do not live with, ensure that you are distanced, masking, and preferring the outdoors. Do not meet if you're sick. Get tested and self-isolated instead, and please get your shot. Thanks to the provincial allocations, all adults 18 plus are eligible as we expand offerings across the region. Our mobile clinics are getting into more workplaces to vaccinate those who cannot work from home, and also getting more and more to our hardest to reach communities who are otherwise unable to attend at a mass clinic, and Mayor Brown has already outlined some of our big clinic offerings that are coming up. But the message for our majority of residents who can attend a mass clinic, now is the time to get your shot. We have expanded hours, we've increased staffing, we've increased available appointments, and you can even get your first shot this weekend at our Doses After Dark event at the International Center and be part of an exciting 32-hour overnight clinic marathon. Visit peelregion.ca/COVID-19 vaccine to book your appointment now at our mass clinics or for Doses After Dark. And also please know that there are also transportation supports available, and all that information is on our website if you need help getting to this marathon vaccine clinic. I'm also pleased to announce that in just a short couple weeks, Peel Public Health will also open one of the largest vaccination hubs in Canada, thanks to the support of Bruce Power. This will open at the CAA Centre in Brampton and will also provide thousands of additional appointments for vaccine using the efficient hockey hub model that was first employed in Grey Bruce Health Unit, a model that set a daily record for vaccination back in April. We critically require volunteers to support this new initiative, and individuals or organizations who can provide volunteers the support should visit peelvaccinehub.ca. We are closer than ever before, but we need to stay focused. Please continue to limit contact for the short term while we run up our first doses and soon get to second doses, and that is how we will get to brighter and better days this summer. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. We're now happy to take some questions. I see first up we have Courtney Hills from CP24.
Good morning. My question is for Dr. Lowe. It has to do with the comments Mayor Brown made off the top of the press conference. Wanted to ask you what you think about the closure of outdoor recreational facilities. You said last month it would be a bit challenging if they were to reopen, but as you know, Mayor Brown and other mayors in Peel Region are pushing to see many of those activities resume. So do you think it's safe to do that?
Yeah, thanks, Courtney, for the question. Certainly, we have started to see a declining trend in our cases, and I think the Ontario Science Table has been very clear that outdoor transmission is 20-fold reduced compared to indoors. I think provided with precautions are taken, I've previously stated that as the weather gets better, there needs to be an opportunity to make better use of our outdoor spaces. So certainly recognizing our provincial partners are contemplating the ongoing stay-at-home order and any potential changes to that. I imagine they are looking at this question very closely, and I would certainly, support any decision to reopen outdoor recreation at this time. Thanks for the question.
Thank you. My next question for you, sir, I wanted to get your reaction to the change that was announced by the province yesterday to stop administering first doses of the AstraZeneca shot. Do you think that's the right move to make?
You know, I think I recognize that the province made the decision out of an abundance of caution. It is specific to first doses. I understand, of course, with second doses that they are still looking at the evidence, and the evidence to date suggests that the risk of the rare side effect that there are concerns about is less pronounced or not seen as typical in the second doses. So I understand that this pertains to first doses. I would say, you know, the aim really is to try to get vaccinated as quickly as possible, and so to our residents, whatever vaccines are available in our clinics at this point in time, we are adhering to the province's pause on first doses for AstraZeneca, and I still encourage everyone to make sure that they're showing up and getting whatever dose is offered to them in our clinic while we adhere to the ministry's pause. Thanks for the question.
Irene from 680 News.
Hi, good morning. My question is for Dr. Lowe. 16.3% positivity rate, almost double the provincial average. Lots of vaccinations, as you mentioned. Where are the cases coming from? Why is the number still so high?
Yeah, thanks so much, Irene. The reality is that we've always had significantly high levels of transmission here in Peel. We did have a third wave that also started a bit later than the rest of the province because we remained in the stay-at-home and restrictive measures for a little bit longer than other jurisdictions. But we were always at a high level, and it didn't take much to push us up even further when increased contact resulted in the third wave in our community. So it is going to take some time to see that come down. However, we are seeing our cases drop. We're seeing almost a 20% decline in the last week, and we're hopeful that that will continue, both with residents sticking to the precautions and reducing their contact as much as possible, and our ramped up vaccination effort. Thanks for the question.
My follow-up is also for Dr. Lowe. In terms of variants of concern, the one that originated in India is now being labeled that. Is there concern that if we get more of these variants introduced, that we could see the numbers rise once again without having 2 doses of a vaccine?
So, Irene, I think that's something that the Science Table is, I believe, actively looking at, is really how they're going to move forward with second dose prioritization. I think it's really vital to highlight, though, that we are in the midst of a significant third wave here in Peel that is being driven by B117, and we haven't had any specific signals that B1617 or any other variants are really on the rise, save and except for P1, which is associated with a cluster of cases that we've identified, but not seeing broadly in the community yet. B117 continues to be the dominant variant, but we will continue to monitor and advise if we're seeing any other variants of concern driving significant trends in the near future. Thanks for the question.
Okay, Sabrina from the Mississauga News.
Hi, so my questions are for Dr. Lowe. So I would like to talk about the new pop-up with the Roots Community Service, which will be vaccinating Black residents. I know a similar pop-up occurred in Hamilton, and there were some mixed feelings from the public. I'm wondering if you can talk about the importance of this new decision.
Yeah, so thanks so much, Sabrina. This has really spoken to the different approach that we've taken to pop-up and mobile clinics here in Peel. Our aim was not to have a pop-up clinic that was available for all comers and people waiting for hours in lines overnight, etc. Our focus is really trying to get to the hardest to reach communities, people who might otherwise not have access to a mass vaccination clinic or might not feel comfortable going to a mass vaccination clinic. We know that there is historic distrust in within the Black community around medical interventions. We know that there's a need to work very closely with community partners to increase vaccine confidence in the community. And so I think that is why we have partnered with Roots and with other important community agencies to ensure that we are able to provide something that is culturally congruent, that is really reaching out to the Black community to ensure that they can, the Black, African, and Caribbean community, to ensure that they can access this important protection. Thanks for the question. You had a follow-up?
So my follow-up, I just want to talk about what your opinion is about the increased calls for the closing of Pearson Airport for leisure and international flights.
You know, I think one thing that's really important is that solving COVID-19 is going to be like a puzzle. We have significant rates of community transmission that necessitate our ongoing vaccination campaign as well as our ongoing precautions. But we also know that introductions from elsewhere in the world, particularly of variants of concern, will remain a significant threat in the future. So I think I understand our federal partners are looking at things as we bring the third wave and as we bring COVID under control in our community. We recognize that there are many places in the world that do not have this under control. And so I think certainly quarantine measures, border measures, as well as international travel is something that will likely need to be looked at as we bring things under control in our community. Thanks for the question.
Yeah, and just to add another perspective to that question about why working with these community organizations is so effective, I'm going to ask Councillor Charmaine Williams to share a few words. I know we've had a number of community organizations we've reached out to get vaccines in arms. The BAPS clinic was very successful. The Brampton Islamic Center just this weekend was very successful. And Roots is an organization that Councillor Williams has worked very closely with, along with the City of Brampton. And I've been really impressed with their ability to engage the community, and Councillor Williams can speak about this organization.
Thank you, Mayor Brown. It's a great question. There has been a lot of vaccine hesitancy amongst the Black African Caribbean community, and Roots has been working with a number of community partners, and we've actually created the Black Mental Health Action Task Force. And out of that task force came this initiative that's going to be running until June. So there's plenty of opportunity for, and I want to encourage all members of the Black African Caribbean community to go and check out the clinic. Even if you go check out the clinic and then book your shot for another day, you'll see that there are trained nurses who are going to take good care of you and make sure that you are protected and you are protecting your whole entire family from the COVID-19 pandemic. This vaccine, this pandemic has really impacted the Black African Caribbean community, and so this is going to be really helpful to see us get back on top of things and protecting, because we know many of our community are nurses and frontline workers, so we want to make sure that you guys are protected and helping your family and the City of Brampton. Thank you.
Our next question is Sumit from Omni News.
Hi, good morning, everyone. My questions will both be for Dr. Lowe, please.
Okay.
Yeah, go ahead,
Dr. Lowe,
Sumit.
it was just over 2 weeks ago, you took the first step to order that workplaces with 5 or more COVID cases would be shut down. With 2 weeks often being that time period where we see some change, have there been any indicators that this move has helped bring the numbers down?
Yeah, Sumit, thanks for the question. Absolutely. We're seeing, as I mentioned, a 20% decrease now. I think a lot of that is related to the stay-at-home order, the move to virtual learning, and also the expedited closure of workplaces that are in outbreak. We continue to see cases on a daily basis starting to decrease. And I have to say we're very grateful for all the business owners that have actually worked with us. They've understood the gravity of the third wave and the risk that it poses to their workforces and their community, and we're really grateful that they've largely been very collaborative in helping with this measure.
Thank you. And about the CAA center that was just announced, am I correct in saying this is going to be one of the largest vaccination centers in the country, and when might we see this open up?
Absolutely, that's correct. This is going to be one of the largest vaccination hubs in the country. It is being built with almost a regional focus in mind. As I mentioned, here in the region of Peel, we are getting towards 75% first doses, and then hopefully on to second doses, as with the rest of Ontario. But we do recognize that there are many other areas in the GTA that that could easily access this. So we're trying to figure out how best to ensure that this is deployed first to protect our community as a whole, but also just to really ramp up overall vaccination efforts here in Ontario. And we're very grateful for the increased provincial allocation as well as the partnership with Bruce Power that have made it possible. Thanks for the question.
Okay, our next question is Steve from in Brampton.
Hi, this question is for Dr. Lowe. And the question is, considering we're a couple of weeks away from possibly the stay-at-home order being lifted, do you think it's maybe too disruptive to send students back to school for just 1 month?
Well, I mean, Steve, I think it is very clear that the best place for students is in person, just for their well-being, their mental health and development, and their socialization. I think, we are obviously monitoring the trends very closely. One of the challenges, even as we get close to the expiry of the stay-at-home order, is that our hospitals have not yet seen their capacity relieved, right? We still have significant ICU patients, surgeries have not started up yet, transfers are still continuing. So without that escape valve, I think a broader reopening of the community would mean increased cases, and then the proportion that then add more pressure to the hospital, which is something that I think would be, would make reopening a bit premature at this point in time. But where it is safe to do so, we know that schools are always the last to close, first to open, just for the benefits that the children derive from it. Thanks for the question.
Okay, just a follow-up to that. Then, what are you saying exactly? Do you think it's okay to send students back to school in June?
So, Steve, like I said, it'll depend on the trends, but to the extent that we're trying to get to in-person learning as soon as it's feasible, we would hope that we would be able to derive those benefits for children. So it's too early to say whether it's June or whether it's not, because the trends haven't necessarily gotten to a point where we can say that definitively. But at the point where we are able to send children back to school, we know that in-person learning, has significant benefits for children. Thanks.
Thank you, Steve, for the questions. Our next question is Nitin Chopra from Prime Asia TV.
Thank you, Mayor. My question is to Mayor Brown or bylaw director. Since pandemic started, many companies, they are operating from Brampton and selling liquor 24/7 across GTA. We approached AGCO and they said since they are not licensed and they cannot take any action, even selling on a higher price. Does that, in the knowledge of city, any action being taken? If not, then why? Thank you.
So I'll have Paul Morrison, our Director of Bylaw Enforcement, speak to that.
Thank you for the question, Nitin. We are aware that it's taking place in the city. We don't know how much is happening, but I can tell you this is a Peel Regional Police problem, or not a problem, sorry, a Peel Regional Police issue. They enforce the Liquor License Act under the provincial rules, and they have the authority to go in and to deal with these situations. So I would actually defer to Peel Police.
I will follow up on this. Next question is in terms of the air travel. A question for Mayor Brown. Since the Indian variant, it has been declared as a variant of global concern, and 3 hotels in GTA, they are having a COVID outbreak. So still flights are landing. Any concern on that?
Absolutely. I've been very public in my concern about the loose restrictions at the airport. I believe that we need to have much tighter rules during the stay-at-home period. It's only a matter of weeks until we get through the stay-at-home order, but the last thing we should be having when we're telling people to stay at home is the ability to travel internationally for leisure purposes. And as much as they have canceled direct flights to India and Pakistan, the travel companies simply rebook non-direct flights. And so it's a half measure. And I think everyone has friends on Facebook. If you look, they're abroad internationally. Let's not be naive about this. There is international travel happening. There is international leisure travel happening. And that's how, earlier this year how we saw some variants get into the country. If you look at the havoc that was wreaked in some of our long-term care settings, I know in Barrie, in the riding I used to represent, there was a long-term care home that had over 70 deaths because of a UK variant that entered the country. If you look at the dominant form of transmission, as Dr. Lowe has said, it's variants now in Peel Region. So yes, I want tighter restrictions at the airport. I know they're saying it's only a small amount of cases they get through, but those small amount of variants can then become thousands. And so I believe it was a mistake that we haven't been strict at the airport, and I really believe that this needs to be adapted as quickly as possible. It will help us get back to normal sooner if we don't have any loopholes in the toolkit of responses. Our next question, our last question, is Nikki Cedroni from the Bramptonist.
Hi, good morning. My questions are for Dr. Lowe. Health Canada has approved the Pfizer vaccine for children aged 12 and up. When do you see these vaccines coming to Peel?
Great question, Nikki. The Ministry of Health has a pediatric table that is actively looking at the question of vaccinating 12 to 17-year-olds, and we are waiting for ministry direction on that. But certainly we want to ensure that we get to that population without delay, both to provide them protection as well as to get to additional coverage that will help to stop the virus in its tracks in our community. Thanks for the question.
Okay, my next question is for you also, Dr. Lowe. What liberties will be given to those who are fully vaccinated?
So in terms of full vaccination, again, this will really be a provincial decision, and the Ministry and Public Health Ontario will provide guidance based on scientific evidence. Right now, in Brampton, we are at very high levels of transmission in our community, so my request is if you're partially vaccinated or even if you're fully vaccinated, we know the vaccines aren't necessarily 100%. You may still get mild illness and still be able to transmit. So please, for the time being, while we are coming through out of this third wave, even if you've received, especially if you've only received one dose, and even if you've received two, continue to follow the precautions at this time. When we get to lower levels of community transmission, the province will advise as to when we can start looking at changes to the precautions. Thanks for the question.
Okay, well that completes our questions for today. I want to thank everyone for tuning in to our COVID-19 update. Stay safe, stay healthy, and listen to the advice of public health.